On March 23rd, the Patient Protection and Affordable Care Act was signed into law, setting into motion the most comprehensive health care reform in our nation's history. Certain of these reforms are already in effect, while others will be phased in between now and 2018. So, do you know when and how these reforms affect your business? Topics for discussion include healthcare reforms that are effective in 2010, in other words, those that have the most immediate impact. Within that category, we will talk about the most immediate reform provisions, the coverage and the plan design requirements that are included in those provisions. We'll talk about grandfathering and how that may impact your plan, and we'll also talk about tax credits, how much may be available to you, how to determine if you're eligible, and how to capture those tax credits. Topics for future discussions will include healthcare reforms that are effective beyond 2010, and that includes from 2011 through 2018 when the reforms are fully implemented. Within that would also include additional coverage and plan design change requirements. We'll talk about employer penalties that would also apply to employees for failure to obtain coverage. We'll talk about insurance exchanges, excise taxes, and Cadillac plans. Healthcare reform affects virtually every employer, regardless of size, and requires prompt action in order to comply. I recommend that you register for our webinars at odysseyonesource.com/healthcare. Get your questions answered, find links to additional resources on these topics, review frequently asked questions, and contact an Odyssey staff member for an immediate response to specific questions or inquiries. Thank you for participating, and we look forward to having you join us at a future webinar.